All righty, here we go. What is going on, everyone? Welcome back. My name is Dr. Phil Sarpong. We are live officially, and I'm going to wait till a few people come through. I just want to make sure the audio is coming through. Let me see here. Okay, for those of you who are coming through, can you put in the chat if you can hear me okay? I just need one verified person who can tell me that they can hear just fine. I'm gonna wait for a few more minutes. People who are coming through, can you let me know if the audio is coming through? Just want to make sure. Check 1 2 1 2. Can y'all put in the chat if you can hear me? Real quick, can anyone put in the chat if they can hear me okay? Just want to make sure the audio is coming through. Check 1 2 1 2. Once again, are you all able to hear me? Those of you who are here. Those of you who are here live streaming, welcome. Go ahead and put in the chat if you can hear me. Okay, awesome, awesome. I just needed one verified yes. Thank you so much. Awesome. Okay, and we got a few more people coming through. Okay, let's go. Happy New Year. Hope you all are doing well. My name is Dr. Phil Sarpon. This is Phil's Guide to PsyD. Hopefully you all had a great New Year, good holiday. Hopefully you're rested up, getting ready for 2026. I thought it would be fitting to do a live 2026 live stream just to be able to kind of get the ball rolling in terms of helping people for this year. I've gotten so many questions from people about graduate school this year. Obviously, there's a lot going on specifically in the US. There's some hesitancy of whether or not people want to pursue grad school. Maybe they're looking at the affordability. Maybe they're looking at student loans. Maybe they're looking at what's going to happen with just so many different things. And I think a question that I keep getting is this still a career that I should pursue in 2026? AI is becoming more advanced. Therapy is becoming more expensive. Am I going to have a job? Is this a good job? Right. And if you are getting ready for interview season, getting ready for questions, getting ready to prepare to pick your graduate schools and figure out what schools you want to apply to, there are just so many questions to think about. So, like always, I do have a list of things that I can talk about for today. But the best way that this live stream works is that you all come with your questions. And so, if there are specific questions that you have, please put them in the chat below so that I can see them and I can answer some of these questions as we go. I'm going to do some formalities when it comes to this channel. We are growing, we're advancing, we're hoping to just kind of expand and continue to grow our audience. And so, if you have Spotify, if you listen to podcasts on Apple, we are on those channels as well. And those are the longer form interviews that I've done. So if you want to support there, you can do that. I'm on Instagram. I'm on TikTok. I was really avoiding TikTok to be honest, with you all. But there are so many people who watch those videos who listen to me through that platform. So we are on TikTok as well. You can follow me on everything: YouTube, Instagram, TikTok. Uh, all of that is great. Some of the content's going to be different, specifically with Instagram versus TikTok. So I think it's great to follow me on all of those platforms together. So the topic today is going to be clinical psychology interviews, number one. And the number two, for those of you who are thinking of applying to graduate school this year, how to pick those schools, how to navigate the applications, and how to essentially really get matched with the school of your dreams, the school of your choice. Okay. So that is what we have on the agenda. Please like, please share this video. If you have not subscribed yet, please subscribe as well. But without further ado, we will go ahead and jump right into it. Again, if you're coming in through the live stream, go ahead and post your questions. Post your questions. And as I see those questions, I can take a look at that and we can go through that together. One more thing, in terms of being a member, if you're looking to really help support this channel in terms of the growth and what we do here, one of the best ways is to become a member. So really want to encourage you with that as well. Okay, so 2026. First of all, one of the questions that I keep getting is, should you pursue graduate school in 2026? A lot of people have had a lot of fears, anxieties, and trepidation about getting student loans and making sure that they can get student loans as it relates to graduate school, as it relates to specifically the clinical psychology profession. Is this still a good choice? Would I still pursue clinical psychology degree if I was starting completely all over again? And short answer, yes, I would. There's a number of different reasons why. Number one, there will always be a mental health need. There becomes more increased rates of anxiety, depression, PTSD, marital, couple, family difficulties, social anxieties, job loss, financial hardships, grief, you name it. There's so much need for mental health related services. The question is, what type of specialty, what type of field could you really get into? I do think, again, mental health stigma is decreasing, which is good. And that is going to pave the way for mental health professionals. What becomes more difficult is how you get to that path. I've had a number of videos about whether or not to pursue a master's or even pursue a doctorate degree. I think if you're looking for the most financial, efficient way possible to become a mental health profession, I would look into getting a PhD with that stipend. That is, I think, the number one way to go ahead and get your degree. If you are looking really more so for clinical practice and a range of opportunities that you might have from a professional perspective, then I think the PsyD is a great option. Now, here's the thing: not all PsyDs are created equal. So you need to find programs that are APA accredited. You need to find staff members who have been there for a long time. High turnover rate for any staff in any type of school is not good. You need a low attrition rate, which means that there's a low number of students who are leaving the program every single year. And you need to make sure that it has a good specialty, that it has options for you. Maybe it's sports psychology, maybe it's health psychology, maybe it's neuropsychology. The way to go, and it's kind of like this in medicine, the way to go is specialization. It's true for medicine, and it's also true for clinical psychology. If you specialize in something, you will most likely be guaranteed a really good job. You'll have probably a higher salary than most average psychologists. For example, specializing in neuropsychology, I mean, that is a specialty type of field where you can get board certified and it's protected. And not only that, but it is a specific type of skill set that not a lot of psychologists know how to do. And so, in terms of setting your own rates, private practice, opportunities for practice in hospitals, in VAs, in community health centers, it is great. All right. So, even if you don't know what you want to specialize in, I would look into just dipping your toes in different types of specializations. Okay. So that's the other thing. So in terms of choosing a good program, those are some of the things that I would look at. I usually am not the type of person to give you a list of here are the top 25 schools of PsyD programs because it just depends. It depends on you. It depends on what your wants, your needs are. It depends on your geographic location. If you want to move to a different state, if you want to stay. So I think it's better to have those main principles of long tenure for staff members, making sure there's a low turnover rate, low attrition rate, a lot of good specialties in the program itself, and hopefully a lot of good opportunities to make money on the side, either as a teaching assistant, a research assistant, or any type of other work assistantship program that's embedded within the program. And even if it's a PsyD program, I know it's going to be expensive, but I would still pursue it because there might be opportunities to apply for grants, to apply for scholarships, which will help decrease the cost of school altogether. For me, myself, I was a TA, I was a research assistant. I also worked part-time as a personal trainer. I got scholarships, I got grants. I significantly was able to reduce the financial burden of graduate school, even though I pursued a PsyD program. To be honest with you all, I'm on track to probably, really figure out my financial situation now that I'm working as a psychologist and making a little bit more money. And so a lot of times people ask me, do I regret pursuing this idea over the PhD? No, because it's exactly what I wanted to do. And I knew that I was going to have to figure out the financial plan and the financial burden of a PsyD program. But that's why I started to look at that before I got into graduate school. All right. So if you are someone that has a plan on how to pay off graduate school, I think the PsyD is a great option. But again, if you want the most efficient, financial, efficient, safe way to have the least amount of debt and probably ensure your success rate, I do think the PhD programs are great, even though they're more competitive. And even though you have to be careful because not all PhD programs will give you a stipend or will necessarily pay off your loans. So you still need to do your due diligence and make sure that you're picking the right PhD program if you go for the PhD route. Okay, awesome. So that was just how to pick a grad school. We do have, it looks like our first official question. All right. They said, hello, Dr. Phil. I'm going to start my second semester in IO psychology. And sometimes I don't even know how to either get a job. It's hard to get into, I believe, into. Do you have, or internship? Do you have any recommendations? I know that's a little bit of a different path. Yeah. So wonderful question. IO psychology is a little tricky. So it sounds like your second semester in IO psychology. So I'm assuming that's a graduate program. You're pursuing your master's. Maybe it's a 2-year master's degree in IO psychology. So the best advice that I can give is network, 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 especially in IO psychology. For me, in my internship, I did a mini rotation in IO psychology, but it was in a hospital-based setting. The private sector is all about relationships. And I think, honestly, this is going to sound a little wild, but I think, honestly, even if you wanted to get your foot in the door and maybe volunteer for certain IO firms, and build relationships through that networking, that might be a great way while you're in school right now. That might be a great way to set up some really good relationships. So you can go on LinkedIn and you can find different IO firms, IO psychologists, and you can say, hey, I'm an IO student. I'd love to just volunteer my time. It works two ways. They basically get to use you for free services or for free help, but you get to learn about the firm. You get to learn about what they do. You get to learn about assessments. Sometimes you might be able to get free either advice on how to get some of those other jobs. You also might be able to get some opportunities to get some things in your CV as it relates to certifications, right? So you can get certifications in different IO assessments, Myers-Briggs, there's Ocean 5, right? So there's a number of things that you can do through volunteering. And because you are already an IO psychology student, that already, it looks really, really good. So network with your professors, network with other students who have finished the program, network with alumni who have graduated, network with people in your area, seeing if there are any businesses or organizations that have utilized IO psychology. Maybe ask those businesses who they've worked with, and then contact those businesses and organizations to see if you can get your foot in the door and volunteer with those people. All right, that's probably the best advice that I can give with IO psychology. So much of it is networking, but once you've networked and once you've gotten in the right firm, then the referrals will start to come a lot more. I usually advise against going on your own and doing private practice right away with IO psychology, because I think so much of it is tied into the business relationship. So once you work for a while in a firm, then maybe you can go and look into private practice. All right, so hopefully that answers your question. We have another question that we got. I am interested in social organization psychology, but I have a business background, not in human resources. It is difficult to get into that area of psychology for a master's without having done psychology. Okay, so social organizational psychology, that's a really cool specialty. And you have a business background, which is good. So it sounds like you're not wanting to go into human resources, but it looks like it is hard to get into that area for a master's. So you're looking for a master's specifically with that background. And then you said without having done psychology. I do know that when it comes to the master's programs, there's so much range and diversity of options. A lot of times they will require those psychology core classes. And that is true. You probably will have to take Psych 101, Psych 102. Maybe they don't require the major of psychology, but they require you to have taken some prerequisite courses before applying to that program. There's a couple things you can do. There are post-bac programs that are specifically in psychology that you can get those classes. You can also get some clinical training, some research work all tied together. They can be expensive, but it might be a little less or a little bit more affordable than a graduate school option. The other thing that you can do is that maybe in a community college, you can take some of those psych courses to get those prerequisites. I would also reach out to the school specifically, because here's the thing. Maybe you apply to this program, you get accepted, and you start in their program. There are programs that will accept students who have not finished those prerequisite courses. Why? Because they still want you in the program. But what they may require you to do is that they may require you to take additional psychology courses while you're doing their master's program, to make sure that you can finish all of those prerequisite courses within a year or two. In fact, a lot of my people in my cohort didn't finish all the prerequisite courses, but they got into graduate school. They got into the doctoral program. They were taking doctoral level classes, but they were also taking like some psych courses on the side to make sure that they finished all of those prerequisite courses. So I would specifically email those programs and see if they have some type of either networking or sort of contract relationship where you can get into the program, you can still apply, you can get in, but you can take some other courses on the side. And that way, from a financial perspective, it's all kind of included already in the graduate program. So hopefully that answers your question. I think it's great that you have a business degree. And I hear you in that it might be difficult to get some of those psychology courses specifically for the masters that you want. But at least, hopefully, whether you're contacting the schools directly or going to community colleges or maybe even looking online for post-bac programs, hopefully that will get you all of the courses that you need on your CV and on your resume and on your education to be able to apply specifically for those types of programs. So hopefully that answers your question, but really a great question on that. So as more questions come in and as more people start to fill in, I will talk a little bit about clinical psychology interviews. Now, a number of you, again, are applying to clinical psychology programs, and you got some interviews, which is amazing. That is probably the hardest part is over. You got an interview. I know a lot of people have been contacting me about having interviews in January and February. All right. And you're wondering, okay, how to really fully prepare for this. You're looking online. Here's what I will say. And this is coming from someone who was on the admissions board, even as a postdoctoral fellow. I still work with interview situations for externs, for interns, and also for post docs, even in the hospital that I work in. So I can tell you specifically what they're looking for, what are some red flags that they don't like to see, and how you can kind of best prepare for these interviews. The best thing that you can do is mock interviews. I'm telling you, the best thing that you can do is mock interviews. Mock interviews with your friends, your family members, your loved ones. You can do mock interviews with me. You can reach out to me on my email or even on social media, and we can set up a business call and or a coaching call and figure out how to make sure that you're best prepared. But I think mock interviews are the way to go. Now, you don't want to be so scripted that you sound like a machine. You do want some fluidity and some genuineness as you're answering the questions. But I think just to familiarize yourself with the process, mock interviews are great. For anyone who is really nervous about some of the questions that you might get, I want you to look up something called performance-based interview questions. Again, I'll say it again, performance-based interview questions, and I'll put it in the chat. Look up this online. I think there's a lot of different types of interview structures for schools, for programs. They might ask you about why you're applying to the program, what lab you're applying to, why psychology, why PsyD or PhD instead of a master's. Those are going to be like the basic questions, right? Or the basic, or some self-care questions. The more difficult questions are going to be more performance-based. Performance-based interview questions are basically where you go in and they might be typing word for word everything that you're saying, because they're going to take that transcript and they're going to compare it to all of the other either prospective students or applicants, and they're going to score your answers. And they're looking for a couple things. In the question, they might ask different parts. What made you decide this, or tell us about this, or whatever. They might ask you 3 questions in one, and they want to make sure that you've answered every single part of the question. Number one, so they're going to score you on that, maybe on a Likert scale of 1 to 5. They're also going to score you on maybe how articulate you were, or the depth of your answer. So they're going to score you on that. And then they're going to have some other scores that they have. And then they're going to go through all of the applicants and see who has the highest scores to be able to offer them an acceptance for the program. So with these performance-based interview questions, you can look it up online. You can look through all of the different questions that they may have. Now, some are going to be more specific for job and internship and residency, but you can still take some of those different types of formats of the questions and still use that to your own advantage for these clinical psychology programs. So again, let me give you an example. They're thinking about situations. They're going to give you situations where you have to figure out how you acted in the past. So for example, they might say, name a dispute that you had with a previous supervisor. What was the dispute? How did you deal with it? And what did you learn from it? Now that's like 3 or 4 different parts in just one question. Studies show that past behavior is more, it involves understanding future behavior. So a lot of these questions, are you reflecting on your past behavior, being able to articulate your past behavior, communicating that past behavior, because then it informs them of what's going to happen in the future if they accept you. So if I answer a supervisor question about a dispute, maybe I'm talking about a diagnosis that I had a dispute with my supervisor. Maybe I'm talking about what I learned, what they were saying, what I said. And then maybe I'm talking about basically how I structured that dispute, or how I resolved that dispute in a professional manner, right? And so they can take that information and they can say, well, if there are disputes, or if there are different types of disagreements that you have in our graduate school program, we can see from your past behavior that you might go about doing this in the same way, in the same professional manner, right? And so that's kind of what they're trying to do. So what I would do is I would list out for some of these performance-based interview questions, uh, have different stories that you can tell about either disagreements that you had with a supervisor, how you dealt with a clinical case, how you dealt with a research problem or a research question. Just go through those questions and see what you can gather from stories. One of the best ways and one of the best things that I've seen as someone who's been on the admissions side of things is that students, prospective students and applicants who are able to articulate really thorough, well thought through questions and stories about how they dealt with past situations tend to be really good at interviewing, right? You're smiling, you look professional, you're coming in confident, and you are telling a story. And one of the greatest things about a storyteller is that it's memorable. You still want to be memorable with all of the applicants that they're basically interviewing. All right. So if you can have stories for specific situations of things that you've done in the past in your work, in clinical stuff, and research stuff, you will be gold. All right. So that's a piece of advice that I can give for people who are getting ready for interview questions. All right. A few other things, a few red flags that I would not do if I was preparing for an interview. I would really make sure that I'm dressing professionally. I had a supervisor actually recently who was going through interviews for externs and things like that, who mentioned that one of the people who came into the interview didn't wear a suit, didn't wear a shirt or tie, was really more so casual, and it completely threw them off. Now, the person interviewed well, but just based on the fact that they were not professional looking, really threw off this supervisor. So I can't say this enough. Please be professional. Please dress as professional as you can. Even for these virtual interviews, I know it's easy to kind of be more laid back, but even for the virtual interviews and the in-person interviews, please try and be as professional as possible when it comes to your dress attire. The other thing that I will say is, or sort of another red flag, when it comes to group dynamics. So when you go through an interview day, you might meet with the program director for about 30 minutes to or 45 minutes as they're talking about the program. You might have two or three individual meetings with a faculty member. And then towards the end of the day, you might meet with some of the other applicants in sort of a group setting. Keep in mind, if it's in person, you are being watched at all times. How you interact with the staff, how you interact with the other students and the applicants, how you interact with the janitor, how you interact with people that you don't think are actually watching you is so, so important. I'll tell you another story. There was a time where a supervisor interviewed a student and they did really well. Great interview, right? And they were leaving the building, and the supervisor went up to the front desk and said, "Hey, I had a really great interview with this person. What did you think in terms of them just coming in?" And the front staff person said, "You know what? This person was incredibly rude to me. Just like didn't have a good attitude, kind of had a stank attitude, didn't say good morning, just kind of wrote me off." And that supervisor did not accept that person into their practicum setting. And and so I tell that story just to say there are people watching, and they can go to other people who maybe you walked by, who you just said hello, and they can still ask them certain things about what they saw about you. So of course you're on your best behavior, but uh, sensible things like being respectful for people, to people, towards people, I think is so, so huge. In those group settings, it can get a little tricky because you're competing against these other applicants. You don't want to talk too much and you don't want to talk too little. You want to, I would say, in those group settings, there's a couple things you can do. You can pick opportunities to be a little bit more aggressive and talk quickly, or be the first person to answer a question. But then maybe in later settings, you can be more on the chill side and allow other people to talk. I think that's a good balance. Because you don't want to seem like you're dominating the conversation when there's other applicants, and you don't want to seem like you're talking too little, because it shows, and you may come across as disinterested in the program, and that may not be what you want. For people who are shy, people who are introverted, I would write down a list of topics or questions that you can ask your faculty, that you can ask other students, that you can ask other people, to kind of start that conversation going and to seem more interested, even though you may be more of an introverted, laid back type of person. In the interview person, you do want to be more direct, a little bit more aggressive, and a little bit more extroverted, because you want them to see the side, like the actual side of who you are, right? And the less you talk, the less you participate, the less they know about you. And so the more outgoing that you can be and the more outside of yourself that you can be, I think is really important. I will say during my interviews, after the interview, I was exhausted. I'm naturally more of an introverted person, but I tried to be as more outgoing and extroverted as I could. And it was tough. I was gassed by the end of the day, but it paid off, right? It really did pay off. And so for those of you who have those in-person interviews or those virtual interviews, the virtual interviews are a little bit tricky because you, again, through a virtual format, it's almost like you have to be a little bit more outside of yourself because they don't really see all of your mannerisms and everything like that. Have some great lighting, still look professional, and make sure that you can always test your audio before, I think is also really good. Now, in the past, this is what I would say. I would say, write thank you letters. And I actually did this in person when I went to in-person interviews. If I had a really good conversation with a faculty member or the person I was interviewing with, or even if it was a current student, I had 3 thank you letters in my bag. And sometimes I would give a thank you letter to a student, I would give a thank you letter to a faculty member, and I would give a thank you letter to maybe someone else who was in the program. And I think this is good to have on hand. Now, you shouldn't just give these randomly. I gave this to people who I had really good conversations with. I had a good conversation with a current student who was telling me about living situations and affordability. And I felt like we clicked really well. And I felt like they were able to answer my questions. And so towards the end of the day, before I left, I wrote them a thank you card. Same with another faculty member. We had a great conversation in my interview. I felt like we really clicked. I felt like there was a good bond. And so towards the end of the day, I made sure to hand them a thank you card that I wrote right before I was about to leave. Now, again, I'm not saying that this is what got me in or what got me accepted, but I think in today's day, it's becoming less common. And honestly, anything that you can do that shows who you are in terms of your genuine side, but because not a lot of people do this, it will make you stick out and it will make you more memorable. It's not going to be the thing that gets you accepted, but it will be the thing that keeps you probably in people's mind and in their conversation when they are choosing people and when they're thinking about setting an offer letter too. So just keep that in mind. Now, virtually, you can still send an email afterwards. And again, you want it to be genuine. Keep it short, keep it brief, maybe 2 or 3 sentences. Hey, I really appreciate the conversation that we had about the advice that you gave. It was great talking with you. I hope you have a great rest of your week. And maybe I look forward to talking with you soon. And that's it. And so if you do decide to send an email, try and make it personalized. Don't just send a blanket templated email. I think people can see through that. And so that's why you want to base it off of good conversation. If you had a really good conversation with someone who maybe they were from the same city as you, maybe had a similar childhood as you, maybe liked the same sports team, maybe liked a similar hobby, you can bring that into your thank you card. You can let them know, and then you can kind of go from there. And so I think that's a wonderful way to really connect with somebody. Before I keep going, for those of you, again, who are coming in, please let me know. Make sure, if the sound's not working, if the sound's still coming through, let me know. And then please keep asking any questions that you might have. All right. Put the questions in the chat. The chat is live, and so I can see the questions as they come up. But again, you might have questions about interviewing. You might have questions about applying for grad school. You might have questions about grad school itself. Could be dissertation, could be research, could be things that you are envisioning in terms of a clinical psychologist. Please put down those questions as they come up. I will read them and I will try and answer them to the best of my ability. So those are some of the things I've talked about already. We've already talked about interview. Really just be confident, practice a lot of mindfulness and breathing techniques. You're going to do well. All right. You just be yourself and you're going to do just great. So that's interview stuff. And then I talked a little bit earlier about how to pick the right school when it comes to grad school. We have a comment in the chat here. Hi, Phil. I was told some grad programs do not give credit to a PhD program. Is that correct? So I am assuming, like, are you saying like basically you're applying to graduate school, you're applying to a PhD program, you're coming from a master's program, or you're coming from college and you're wondering if those credits are going to transfer into a PhD program? That might be the case for certain schools. Oh, if you, yes, okay, so if you have a master's program. So if you have a master's program, will those credits transfer into a PhD program? This is so dependent, unfortunately, on the program itself. I've seen both ways. I've seen PhD and PsyD programs take lots of credits from a master's program. Let's say it was a master's program in social work, in professional counseling, in a psychology degree, in IO psychology, in sports psychology. Health sciences. Let's say it was a master's program like that. There are programs that will take credits from that program. They may not take a lot of it because they still want you to pay a lot of money for their program, but they may take some of those credits. I've seen that 100%. It just depends on the school. So I would email the school and I would just see if some of those credits are going to transfer, but maybe before you apply or before you interview, just to make sure. For me, I had a master's in health sciences. I took research classes, I took stats classes, I took some psychology, neuroscience classes, and I still basically had to take every single class in my doctoral program. None of my credits transferred at all. I've seen where from students, like for example, if you got your master's in the same program that you're wanting to apply for a doctorate, that tends to be a lot better, right? So, like, let's say, for example, you got a master's in counseling years ago at that school, and then now you're applying to their doctoral program. That is more likely to get those credits transferred into that doctoral program because it's kind of the same school system. If other schools have other relationships with other schools, you might see that more likely as well. Tend to see that more common for geographic location. So let's say you went to undergrad in one school in a city in Texas, and you're also going to apply to another school, but it's a doctoral program in the same city. Just because of the geographic location, or maybe based on the partnership that those schools might have with each other, they may be more likely to accept some of the credit. But I've seen it both ways. I've seen students where they're able to do 3-year programs instead of 4 or 5 or 6-year programs because they got a lot of their credits transferred. But I've also seen the case where a lot of the programs rejected a lot of those credits and basically had those students take a lot of those classes all over again. I don't know the science behind it. I don't know the mindset behind it, but it really is dependent on the program. So hopefully that kind of answers your question. But yeah, really, really great question. If you can get those credits transferred and get through school earlier, all the better. All the better. It means less loans, it means less time, and it means that you get to do what you want to do in a much faster way. So, yeah, 100% on that. So, once again, any other questions that might be coming through, keep them coming. But if not, I will kind of go on in terms of what we're talking about. So, we've already talked about trying to find the right school. We've talked about maybe you're in the graduate program already, but you might be getting ready for interviews. Could be interviews for practicum or externships, could be interviews for internship, could be interviews for postdoc, could be interviews for jobs. So those are some of the things that I would consider when it comes to those interviews. The other thing that I did want to talk about as well is kind of maybe a little bit of what I'm doing right now, so to kind of give people an idea of the path that I've taken as it relates to how I'm using my psychology degree. And a lot of you know, so I went into graduate school in 2020 in the middle of the pandemic, where there was a lot of people who were definitely not thinking about going to graduate school. I went in. Part of my program was virtual, and then it was stressful. It was really stressful trying to learn how to do neuropsychological and psychodiagnostic testing virtually and trying to figure out therapy. My first therapy practicum wasn't until like 3 years later into my program because I was so used to virtual therapy and things like that. And now it's way, 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 way more balanced. But I went through, for me specifically, I wanted to go into more of a health psychology specialty because of my background in the medical sciences and because I got a master's in health sciences. And so my whole thing, even as a personal trainer that I was doing part time, was to really cater my services to behavioral medicine, to more exercise science, to more health psychology, to more rehabilitation psychology. And that's what I was focused on. I did a lot of externships in hospitals, private practices, community mental health centers, VAs. And the whole goal was to work in an interdisciplinary team with social workers, psychiatrists, medical doctors, nurse practitioners, all of that in order to have more of a holistic collaborative approach to helping patients and clients. And that was my goal. That was what I was trying to do. I was also trying to do a little bit of another specialty in trauma and specifically PTSD. And throughout my program, I got some neuropsychology experience as well. So I'm not trained as a neuropsychologist. I don't have that specialty, but I do know how to do a lot of neuropsychological testing and assessment. And that's the same with PTSD and trauma and complex trauma as well. I primarily do therapy, but I can do assessment on the side as well. When it comes to the health psychology, I'm talking about sleep and cognitive behavioral therapy for insomnia. I'm talking about chronic pain and weight management. I've done bariatric assessments for surgery. I've also done some assessments for spinal cord stimulators. I've also done some psychodiagnostic personality testing for things like narcissism or depression, anxiety, PTSD. And then, of course, I've done some neuropsych assessment and testing for ADHD, epilepsy, dementia, or Alzheimer's disease, and other things like that, learning disorders as well. So right now I'm working in a hospital setting. I'm also working in a private practice setting and in a group practice setting, doing a number of range of different types of therapy, specifically for anxiety, depression, and PTSD, but also for the chronic pain, the sleep difficulties, and the weight management and things like that. So that's kind of what I'm doing. And here are maybe some of my goals that I'm looking forward to in the future. Maybe potentially fully doing private practice, maybe doing some assessment on the side, but also maybe having my current job, working still in the hospital with other disciplines as it relates to the healthcare field. Now, what I will say too is that I think one of the things about psychology that they don't teach you enough is a little bit more of the business side of clinical psychology. And I think this is such an overlooked area that I think is so incredibly important. And I know there's a lot of things that are on weighed on people's minds when they're picking programs, but I think one of the things that you still have to think about is what is your life going to look like 5 years after you finish the program? And the reason that I say that is that when it comes to this career, and I'm going to be completely honest with people, when it comes to this career, one of the things that I've learned is that I think in graduate school, I considered this profession I've considered the hard part just getting through graduate school, and then working would be just bliss. It would be so easy. I'd be making money. And some of that is the case. Some of that it has made things easier. I definitely prefer working than being in school. But however, there are some things that I wish I knew in the working profession that I think is really a disservice that people don't know in graduate school. And that's the whole concept of the business side. Insurance is a whole learning curve that you will have to figure out and understand when you become a profession in this career. Negotiating your contract and your salary and what you're going to do, whether you're in a hospital, a VA, a private practice, a community mental health, is so, 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 so crucial. And if you don't know how to negotiate, these hospitals are going to give you a really bad deal. And they are already making, some of them are already making so much money. But they're paying you 30% of your value, but they're maybe giving you some health insurance and some other benefits to make you feel like, oh, this is okay. But the thing is, I think the thing that's really, really important is that as you get into your internship, as you get into residency, as you get into postdoc, and as you get into your actual profession, is to really know your value. Understand what these insurance companies are reimbursing psychologists and therapists. And because of that reimbursement rate, make sure that you are negotiating a really good value for what you need to be compensated. So I'll give you an example, right? So for group practices are include therapists, they include psychologists. In a group practice model, you have this owner of a group practice who maybe they're giving you health insurance benefits, they're taking care of your marketing, they're taking care of your referral network, but they are requiring you to see at least 24 to 26 people a week. They're also taking a cut of what's reimbursed back to you. So maybe for insurance, they might reimburse for a 60-minute therapy session. Maybe it's like $150 that you get back, but the practice will take 60% of that and you only get 40%. Now, maybe you might be able to negotiate a 50-50 split, or maybe a little bit higher. Maybe you're negotiating 60% and they take 40%. But that's something to know. And if you're not licensed, you get a lower cut. If you are licensed, that's a higher cut. And if you are paneled on other insurance programs or panels, then you get a higher cut. And so that's something to consider. If you're going into a group practice, you're going to be the requirement is to see 20 to 30 people a week, and they're going to take either 60 or 50% of what your cut is going to be. Now, if you're okay with that, that's great. When it comes to academic medical settings, this is where it gets a little complicated because you kind of have to climb the ladder a little bit. And this is what I'm talking about, in that this is not what was really taught to us in graduate school, is that you think that once you become a psychologist, you can make all of this money. But honestly, there is a ladder to climb. So in academic medical settings, you might start at maybe a visiting professor role salary and work your way up to assistant professor, or really more of a tenured professor. But that might take some time. And you're going to have to negotiate oftentimes how much time you're putting into clinical work and how much time you're putting into research work, because a lot of academic medical centers require you to do a percentage of your time in research. And so maybe you're 60% clinical, 40% research, maybe you're 70% clinical and 30% research. Those are things that you can negotiate. But it's really important to understand that and to know that. In the VA system, the salaries are they're pretty much what they are. However, again, one of the things that I didn't realize is that in the VA, they start you. There's different levels in terms of based on how long you've been a psychologist, and so you might be thinking you're going to get an average salary as a psychologist right away, but it's actually going to be starting pay, and then it's not until you've maybe been a psychologist for 1 or 2 years that you might get into more of the average rate. But one of the things, again, to think about is that based on your location, based on what other psychologists are getting paid in your area, you might either be getting underpaid or you might be getting paid the average. But those are some things that you need to consider. Private practice, of course, you can set your own rates. You can decide whether or not you want to take insurance. You can decide whether or not you want to just do cash pay, but you still need to weigh the pros and cons of that. And so I say all of this, a lot of this is kind of business-y, but it is things to think about. And then there's the whole academic side of things. And so in a lot of academic settings, whether you want to be a professor and actually be a psychologist, but work in a school setting where you have a research lab and you're helping other students through their research and their dissertation, they may also require you to put in 20% clinical work. Maybe 80% of your time is based on research work or based on being a professor. I will say from my experience, when it comes to all of these different types of settings, they all have their pros and cons. When you're in those school academic settings, they're working you because you have to figure out grants, you have to figure out research work, you're grading papers, you're figuring out dissertations, and you still have clinical requirements at the same time. When you're in those academic medical settings, they don't really care too much about your time. They're going to fill your caseload as much as possible, and they're going to do certain things, certain metrics that will rate your how basically your performance and how efficient you are as a provider. There's something called RVUs, and I'm not going to go into all of that too much in detail today, but that's based on the number of sessions that you see per week, and it's also based on basically how your no shows, your cancellations, all of that takes into consideration. The higher your RVUs, the more you might get a bonus in a hospital or in a VA setting. But all of that takes into account in terms of how efficient you are as a provider. So, again, I say all of this to kind of maybe plant the seed in that, to really get an idea. The best piece of advice that I can give is that as you are a practicum student or an externship or in graduate school, try and get clinical experiences in multiple different areas. And you can still do that even if you specialize. So even if you're wanting to become a neuropsychologist, go and work some time in a private practice, go and work some time in an academic medical setting, and then also go and work some time in a VA or in a hospital setting, so that you can compare all different 3 levels or 4 levels of work conditions to basically narrow down what type of setting that you want to work in. This will be the difference maker on whether or not you actually enjoy what you're doing or you don't. Because if you do not like the setting that you're in, and I see a lot of professions, I see a lot of professionals, I see a lot of psychologists who are great neuropsychologists or great psychologists, but they do not love where they're at. Maybe they're working in a prison system, maybe they're working in a hospital system, maybe they're working in academia. They love what they do, but they don't love the setting itself. Maybe it's too burdensome. Maybe it's too overwhelming. And so the better that you can define what setting that you want to work in, whether it's a hospital, an academic medical setting, a VA setting, a private practice setting, a group practice setting, that is going to make your life so much easier. And all of those settings are different in terms of negotiating the salary and negotiating the amount of time that you want to put in as it relates to your clinical work and as it relates to your performance-based metrics. So the more that you can do some experimenting and figuring out what type of niches, or what really honing down a specialty, number one, but then also number two, trying to figure out the type of setting that you want to work in, is going to be so crucial. And even if you're not in graduate school yet, you can still try and figure out what you might want to do right now, just based on volunteering, but just based on getting research or clinical experience. Clinical experience does not mean that you're a therapist. Clinical experience can mean that you are working in a suicide hotline, that you're working as a psychiatric aide or a mental health aide in a social work setting. It all clinical work means is that you are involved in some type of field where you're helping other people, and maybe in a assistantship or an assisting type of role. And so the different types of either specialties or niches or work settings that you can basically expose yourself to is going to be one of the best things for you, especially when you get into graduate school and especially when you start going into your profession. Once again, for those who are coming in, please, if you have questions, put it in the comment section below, put it in the chat, and that is something that we can definitely look into as we're maybe wrapping up here in about 10 minutes or so. So that is in total what I kind of have for you all. We have talked about interviews. We've talked about picking the right program. And I've given you some things, hopefully, to think about as you go into your profession. Ask questions about RVUs and efficiency metric performance systems. Ask questions about how you're going to be rated on your performance. Ask questions on what it means to work yourself up the ladder in terms of a higher salary in 5, 10, 15, 20 years. Ask questions about different types of niches and specialties. Ask questions about different types of settings that you want to live in. And I will say again and again and again, the PhD, the PsyD, the counseling psychology gives you so many opportunities and a diverse array of options to really look into, because it really gives you the blueprint in that you can navigate and wedge yourself into so many different things. Let's say you get burnt out in 5 years or 10 years or earlier, because that's happening, and you decide, you know what, I don't want to do this clinical stuff anymore. I want to do just administrative things. I want to be maybe a manager, maybe on a team where I'm helping with the hiring and I'm helping with the budgeting and I'm helping with the pay and the salary, or I'm helping with the networking or the structure or the overlay or the coaching or whatever it is. And there are going to be opportunities that you can do that. And so just keep in mind that whatever you do decide to do, it doesn't have to be something that you might do for the rest of your life. You can be a generalist and a specialist at the same time. I think it's a double-edged sword. Being a generalist provides you a wide array of skill sets that you can use, but being a specialist is needed. People look for specialists. In medicine, people are looking for specialists as it relates to orthopedics, pediatrics, internal medicine, surgery, cardiology, right? Their neurology. People are looking into specialties in medicine as it relates to psychiatry and so forth, right? Neurology, all of those things. And people also look into specialties when it comes to clinical psychology, pediatrics, forensics, health psychology, sports psychology, neuropsychology, rehabilitation psychology. So in APA, they have a website where it names about 20 to almost 30 different types of specialties. I would encourage you to look at all of those specialties because specializing is prime. It's the way to go. You don't have to, but it might make your life a little bit more easier. Looks like we have a question in the chat here. Hi there. Thank you for providing this platform. I graduate with my PsyD in 2029. Let's go. So you got a couple more years to go. There has been a lot of talk about AI replacing many careers. Do you anticipate this trend happening for psychologists? Okay, so this is a wonderful question. I actually had this on my notes to talk about as well. So people are worried about what's going on with AI. There's obviously a lot of benefit and pros of AI. There's pretty significant cons too. Here's what I'll say with the AI replacing many careers. Right now, there are apps, there are platforms. We can see AI therapists where they have a human sound voice, a human like a voice that sounds just like a human, and they have these human mannerisms in terms of the avatar or who you're talking to. And I will say, like, even in ChatGPT, there's obviously other different types of platforms that use AI. Right now, AI has all of the extensive knowledge as a therapist. Now, there's a couple things that's off, right? So you can give ChatGPT a clinical case, it will come up with pretty good recommendations, pretty good questions, pretty good assessments, skill-based thinking, just like a therapist. And the benefit of AI is that it has so much knowledge and so much information. It is the smartest therapist that we have, technically, right? It has all of the information of online books, courses, seminars, workshops in this type of technology. And then when they combine it with an avatar that looks human and sounds human, when it comes to virtual therapy, I think this could be competitive to other therapists. However, if you look at the research, and we've seen the research when it comes to therapy, therapy is not just about education. It's not just about knowledge. It's not just about wisdom. It's about connection. People go to their therapist not just because they're wise or they ask good questions. They go to their therapist because they like their therapist. They like who they're talking to. They like something about them, maybe the way that they look, the way that they talk, maybe they have a good therapeutic alliance and a rapport with this therapist. And that has been shown. There's like a 35% success rate when people, more of a success rate when people really like their therapist. They tend to go to the therapist longer. They tend to get better outcomes. That is the human connection, the human relationship that we have professionally with our clients and our patients is prime, is king. And so I will say that what's going to be really interesting is that technically there's a couple things that's happening. Therapy is expensive. Not everyone has insurance, and AI therapy could provide affordable options for people who cannot afford therapy. And technically, because of the wide array of knowledge and wisdom that AI therapy can provide, and if you're not careful, you might forget that this person is actually not real. There could be some competition, especially if AI therapy is affording $40 therapy sessions, while your therapist online at Psychology Today is offering $250 per session. And so from an affordability perspective, they will compete with therapists. However, they may not get better outcomes. They might get outcomes to a certain point, but they may not get the full range of outcomes, because what matters the most is connecting with a real human being. And I can't imagine being a client and talking to an AI therapist and knowing in the back of my mind that this person isn't real, and still forming some type of connection. Now, we do see a lot of people forming connection with AI in all sorts of ways. People are marrying AI things, right? Like there are people who can forget that this thing isn't real and actually form really deep emotional bonds and connections with it. But I think for the average population that knows that it's not real, that knows that it's not fully genuine, it's not fully authentic, I don't think those people are actually going to get the best outcomes with therapy. And I think more people are still going to be inclined to meet with a real therapist. However, this is the caveat. All right. I know I'm going long on this. However, for therapists who are not good, so below average therapists, master's level clinical social workers, licensed professional counselors, therapists, psychologists, psychiatrists, for those who have bad ratings or who are actually not great therapists, if I'm being completely honest, if I'm a client, if I'm a patient, I would rather go to AI therapist than a bad human therapist. I think a good AI therapist is better than a bad real human being therapist. And so I think the competition will just get better, in that people who are not good at therapy will basically make less money because AI therapists will just be out competing them. However, for the people who actually know what they're doing, who are good therapists, who have can build really solid, good connections with their patients and their clients, they're still going to be able to make money. They're still going to be able to have a full caseload, but it's going to keep you on your toes. So if I am someone that is thinking about a PsyD or a PhD program, just keep in mind that the best thing about AI is that you can use it as an assistant, right? So uh, you got to be careful about PHI and HIPAA and all of those things. But if I'm thinking about a hard, difficult case, I can put it in ChatGPT and see what options it's going to give me, or what questions that I can ask, right? Or maybe how I can do this better, or how I can do this better. You can use it as a tool. You can use it as a consultant, and that could actually make you better as a therapist itself. And I think we should be using AI right now as therapists, because that is where things are going. That is the future, essentially. So how we use it is important, and also just keeping in mind that it's going to outcompete some of these other therapists who are not using AI and who are also not good therapists themselves. Now, I was having a really interesting discussion with another psychologist about this too, in that what happens when, let's say, for me as a psychologist, I want to know what you all think about this. What happens when I can take an avatar of myself? And this is already happening. There are celebrities who have avatars that can do commercials when they're not there, right? Because they can take your voice, they can take what you look like, and they can create a whole commercial. And you don't have to be there in person. You don't have to fly out to Dubai. You don't have to fly out to the UK. You can just give your rights away to this avatar that looks like you, talks like you, and then they can create all of these commercials with that. And you can get money basically just not being there in person. What if the same becomes accessible to therapists or other professions, where you can create this avatar of yourself that looks like you, talks like you, basically is you, but it's not actually you. And you can use it to then basically do therapy sessions with clients, where maybe for those who can't afford your rates, they can maybe afford the rates of an AI therapist, maybe $30, maybe $40, maybe $50, right? Whereas maybe you're charging something like 200 or 250. And now, instead of group practices, it's these practices that are not hiring real people. They're hiring basically AI versions of themselves. The benefit of that is that you don't have to pay for people's health insurance. You don't have to pay for their sick leave, their PTO. And you can have this AI version that just works 24/7 for you. And then you could also write it off as a business expense, right? So there's now, here's the thing. I'm not advocating for this. I'm not saying that this is good. I'm just saying that this might be where we're heading in this field. So I think you should kind of keep in mind that if you want to work in a group practice, what are some of the values of the group practice in terms of what they want and what they want to do. And then also for hospitals, I work in a hospital. We're already kind of using AI in terms of our job. Most jobs, most private sectors are using AI to some extent in their jobs. And I think you have to think about, okay, what is going to be the progression and the transformation and the evolution of this thing? And how is it actually going to impact my job? I think the best thing that you can do for yourself is to continue to build your skill sets, be the best therapist, the best psychologist, the best counselor, the best psychiatrist that you can be. But please be using AI as well, because the better you can use AI, the better it can actually benefit you. Don't use it unethically, don't use it immorally or anything like that, but use it for the betterment of assisting you in becoming better at what you are already doing. So, long answer short, I know that was actually a really long answer to your question. Uh, I think that yes, it will replace some things. I don't know what it's going to fully replace. I don't think it's going to replace the psychology or the mental health field completely, because as things have more technology and have more of a basis in technology just in general, human connection is going to be that much more important. uh, Kids who the next generation of children, the next generation of kids who actually know how to speak to people, look them in the eye, have a conversation with them, don't have social anxiety, are going to be leaps beyond other kids who just haven't learned those skill sets because they're on their phone too much, they're on their computer too much, they're in this AI virtual reality world too much. And those kids, those children who have those people skills and those human connection skills, those that ability to connect to another human being, is going to be the thing that it's going to be the skill set that I actually think is going to be more sought after. And now, as psychologists, because we're in a people-based career, we understand the skill set, and so we are actually, I think, in a position where our jobs are not going to be fully replaced, because who can be more human than a human being? It's human beings, and AI will never be more human than us. Now, AI, they will try and program AI to be more human, but at the end of the day, nothing can be more human than human beings. And so, when it comes to human connection, we have those skill sets that are going to be really, really important. I think psychologists are going to be more consultants than ever as relates to AI, because people are going to be realizing that with this technology, it's going to negatively impact human interactions and human behaviors. And so we will have to come in as psychologists and as therapists and say less AI, less technology, and more human connection if we even want to continue to evolve as a species. I'm sorry for my rant. That was a long answer to your question, but hopefully that gives you some things that I'm also kind of thinking about as well. Things that I've talked to my supervisors about, I've talked to other students and therapists about. It's real. And even in private practice, a lot of people are seeing less people come into their practice because they think that these people either economically aren't able to afford therapy as much. Insurance, right? Healthcare insurance is going up and the rates are going up. And so people are not maybe putting as much money into health insurance, or putting as much money into therapy and things like that. But also, people are using AI for therapy. People are definitely doing that right now. And they may not be getting huge benefit from it. But again, if you use it as a consultant, if you use it for knowledge, you can get a lot out of it for free, essentially. So that's my answer to that. Uh, we might have a few more minutes. I know I took a long time answering that question, but if there are any other questions, please put it in the chat below. If you're joining us for the first time, welcome. We've been going for a little bit of time in terms of answering your questions for graduate school, answering your questions for interview, me giving you some insight into what it is to be a psychologist and to ask certain questions about this profession, and then, of course, answering the whole question about AI and technology. I will say, you all, I want to give you all just a little bit of a vision for what we have going on this year. We have way more interviews planned from psychologists, from psychiatrists, from therapists. We have way more videos that we're doing. Please continue to like and share these videos. It does amazing for the channel, and it does amazing for the algorithm itself. It's probably the best way to support this channel is by liking and sharing and commenting on this channel. And so there's a lot of different things that we're going to try, and I want your feedback. This is not just about me, it's about you. Uh, I'm not going to do this channel for me. I'm doing this channel for you all. I get hundreds of questions either per month or maybe sometimes a week. I get people reaching out all the time on Instagram and TikTok. I'm doing consultations. I'm doing coaching. So what I do for this, it's really for you all. And so you can make this channel whatever you want based on the feedback that you give me. And so we have a little bit of time. I'm going to answer some of these questions, and I think we're going to wrap up. So if you have other questions, put them in right now because we're going to be ending very shortly. All right. So we have a question. What's up, man? Hope all is well. Why don't they intertwine spirituality and therapy? Okay. So this could be a whole long answer as well. I will just say that if you go to different PhD PsyD programs that maybe are spirituality based or religion based, they will intertwine spirituality and therapy. Now, just because you don't go into that program doesn't mean that you can't get that training outside of it. There's something called CBT for, I believe it's for either spirituality or something like that to that extent. And there are psychologists, there are therapists who get permission from their clients, from their patients about incorporating and including spirituality. Now, again, you don't force it on people. You make sure that for the client, I have had clients who are like, I want you to include this stuff in our therapy sessions because I'm trained in it and because I understand how to interweave it. I'm more than happy to do so. So there are psychologists and therapists who have prayed with their clients. There are psychologists and therapists who have tried to help clients through spiritual abuse and spiritual questions and confusion. There are psychologists and therapists who have done spiritual meditations and mindfulness exercises. There are psychologists and therapists who will allow clients to interweave faith within the context of therapy. And I always tell pastors this because I've collaborated with pastors and churches in that it doesn't just have to be spirituality. You can do spirituality and psychology at the same time. It doesn't have to be one or the other. In fact, if anything, body, mind, spirit, it's all interconnected together. And so you can get the training in it. You want to get the training in it for sure and understand the theoretical orientations about it. But then also you want to make sure that you get permission and consent from the client because you don't want to enforce your own belief system onto the client. That would be unethical. And so it really needs to come from the client. If they know that you are a spiritual or faith-based psychologist or therapist, wonderful. And in fact, I know so many people that that will research, right, the specific therapist, make sure that they might be some type of faith that they're familiar with, and then go to them specifically. So I don't know why more schools don't do it because spirituality has been shown to be really impactful as it relates to mood, anxiety, depression. But if you get that type of specialty, you will be on a whole different platform itself because it's a great way to specialize your services. And then we said, we had another comment, very helpful. Thank you so much, Dr. Sarpon, no problem. And then another question, how do you know if you'll be a great psychologist? I think there are three things in terms of being a really great psychologist. Number one, you have to be an investigator. Investigator is like, you need to know how to read well. Not necessarily fast, but well. You need to be able to take large context or contents of writing, be able to distill it and be able to maybe kind of even put it in your own words. So much of being a psychologist is just looking at the research. Even as a psychologist today, I read research articles literally all the time. When I'm in my profession in the hospital that I work in, we have seminars, we have workshops where we will review articles. That's just like a part of the profession, is that you need to put on your thinking cap on, have these critical thinking skills, and be able to distill complex bits of information. How to know if you're going to be a good psychologist or a great psychologist? Number one is just going to be able to your verbal comprehension and verbal fluency. Do you know how to read well? Can you read in a way that you're critically thinking what you're reading? The second thing is connection to people. Not only do you need to take lots of information and research and distill it into bite-sized pieces, but you also need to be able to communicate that. And the way that you can communicate that is by connection with another person. Are you the type of person, whether you're introverted or extroverted, are you the type of person that is just a curious individual? You like to ask questions, you like to get to know people, you get a sense of energy and being able to have deep conversations with people. I think that's a great indicator of being a psychologist. Number one, that you're an investigator of information, but number two, that you know how to connect to people. The third thing is this, and I think the field of psychology is, even therapy and mental health, is in a rough state right now where there are way too many psychologists and therapists who are burnt out. Emotional fatigue, compassion fatigue is a thing. It's not a joke. I'm talking people who are graduating are burnt out. People in grad school are burnt out. Professors, academic professors, everybody, a lot of people are burnt out. And there's no way to sustain this career if you're burnt out. You're not a help to yourself, and you're not a help to the person or the client or the patient. So the key to being a great psychologist, for me, this is my personal thing, is investigation, connection, but also self-care. What do you do to take care of yourself, your physical, mental, emotional, spiritual, financial well-being? Because that, how you take care of yourself, no one can love you like you. How you take care of yourself is going to be indicative and correlate to how well you can actually be there for other people. So it's talked about a little bit in grad school. I don't think it's talked about enough, and it's not really mirrored well in graduate school or in the profession itself. So you need to prioritize it now. If you don't prioritize it, you probably will get burnt out. And this is the type of profession where it can be very, very easy to get burnt out. I know people as psychologists and therapists who took years off. They were like, I can't do this. They took years off of being a therapist, to try and come back later because they were so burnt out. And so I know people who like preferred going to graduate school than continue to be a therapist because they were like, I prefer academics in school right now to what I'm doing, because they were burnt out. So I think those are some things that you should definitely think about. And then the other question is, do you think self-help books truly help, or should people consult a psychologist? I would say you can do both. You can read self-help books. I think, keep in mind with self-help books, depending on who the author is, I have a preference to read self-help books by people who have done the research themselves, who are doctors themselves, who are reputable, and who I can trust. And there's a lot of self-help books where people maybe don't have the degrees. And again, I'm not saying that you have to have the degrees to write a book. I'm just saying there are people who are just more of like journalists, and they're like interviewing other people, or they're collecting information from other people. They may have ghostwriters who are writing the book themselves. And rather than going to the source of people who actually know how to do good research, who have published articles and articles and articles and articles, and are also now taking that research and kind of putting it into a self-help book type of format. So I think there's levels to it. And so I would choose the right books if I was anyone looking into that. All right. And so, y'all, we've been here for almost an hour and a half. I know there's still some people live, but if that is all of the questions for today, I think I will log out. I want to really appreciate and thank you all for being here. Thank you all for your participation. Thank you all for the really great questions. Thank you all for the amazing support, the likes, the shares, and the subscriptions. Thank you all for sharing the content. And thank you all for just being with me throughout this journey. And I want to wish everyone who is interviewing the best of luck. You got this. Again, please reach out to me. You can reach out. You can email me at pks.sarpong, SARPONG, at gmail.com if you have questions about interview type questions. All right. Again, that's PKS and then my last name, Sarpong, SARPONG, at gmail.com for interview questions. For those of you who are trying to figure out what schools to apply to, I do coaching, and I try and help students pick the right schools, go through their application process with them, their CV, their resume, their personal statement, their mock interviews. I make sure that they're good to go. And we have helped hundreds of people get into grad school at this point. So it's been amazing to see that. And then the last thing, again, please don't forget to support. We're on Spotify. We are on podcast. We're on TikTok. We're on Instagram. We're on YouTube. So those are some phenomenal platforms to still support us through. And then the last question is, all that schooling even worth it? I'm not sure exactly what the context of the question that you're talking about in terms of master's or graduate school or doctoral programs. I will say this is so dependent on you. I am a proponent of telling you the truth. I'm really not trying to convince people to become psychologists. I'm just trying to convince people to do what's best for them. So, in terms of the doctoral degrees and things like that, you need to know how you're going to use the doctorate. So many people will get a doctorate, just become a doctor, and they don't know how to use it. And they don't use it for assessment. They don't use it for consultations. They don't use it to actually make more money or better their lives. And they're miserable. And they should have just been master's level therapists because they just wanted to do therapy. And if you want to just do therapy, master's is the way to go. It saves you the most time, money, it's efficient, and you can make a great living being a master's level therapist, licensed clinical social worker. So I'm a proponent of it. If or even a counselor, right? Any type of a master's that allows you to have a license as a licensed professional counselor or a licensed clinical social worker is a good career. And there's a lot of things that you can do in terms of opportunities. The only reason really to get a doctorate is if you want to go into academia, if you want to do a more diverse range of things like assessment, psychological testing, neuropsychology testing, consulting, like though that really, or teaching or research, like those really would be the only reasons. And for me, though, one of the main reasons that I chose being a doctorate is that I could have that diverse range of options as well. When it comes to remote counseling, yeah, you can do virtual therapy, but you have to be careful because of the jurisdictions of different states here, specifically in the United States. In terms of therapy outside of the United States or internationally, that's where you'd have to go through the proper jurisdictions paperwork to make sure that's all good to go. But I do know psychologists who internationally come here in the U.S. and then they leave, and I know psychologists who get their degree and then they go somewhere else. But you just kind of have to be careful in terms of how those credits are going to transfer over or those licensures are going to transfer over. So awesome. I hope this was helpful for you all. I hope you all have a great rest of your day. Again, if there are further questions, contact me. The best way is either through Instagram, sending me a direct message, putting a question in the comment section below, and YouTube, or emailing me as well. Stay well, stay safe, and I will see you all in the next live stream. All right.